Hello, my friends. My name is Dr. Saeed Kazmi. You're watching my YouTube channel. Today, we will be talking about lung volumes. Every time you see a child with acute exacerbation of asthma or an acute viral disease episode, you must be wondering about the lung volumes because these are the things, physiological terms that we use when we are doing spirometry as a part of the diagnostic workup for these conditions. Now, to make the things easy, remember there are four lung volumes, and from that we calculate different capacities. Now, I would use a very simple method. If you can see my hand here, remember the word tire, T-I-R-E. Obviously, when somebody is breathless, they become tired. So from tired, you remember the word tire, T-I-R-E. So T-I-R-E. Now, this T-I-R-E stands for four different lung volumes. The first T stands for tidal volume, then I stands for inspiratory reserve volume, R stands for residual volume, and E stands for expiratory reserve volume. Now, let's talk about what are these. Tidal volume is the normal amount of air that you normally inhale with every breath. So, the amount of air that goes inside with your normal breathing pattern is your tidal volume. Now, in an adult, that is 500 milliliter of air. In a child, that can vary from 3 to 4 mils per kg of his body weight. So that the normal amount of air is that tidal volume. Then the next is IRV, inspiratory reserve volume. Let's see if you have got the capacity to take a maximum air. So if you ask somebody to take a deep breath in as much as they can, so the maximum amount of air that goes inside, if you subtract the tidal volume from that, what you get in turn is your inspiratory reserve volume. So this is the amount of air over and above the tidal volume that you can inhale with maximum inspiratory effort. So that would be what? Your inspiratory reserve volume. Then R is your residual volume. Residual volume is the amount of air that is left inside your lung when you force your breath out with maximum effort. So let's say if you ask somebody to take a deep breath in and then take every amount, like whatever they can take out of their lungs, they take out, and whatever is left inside, that is known as residual volume. Residual volume is a little bit of air which is left inside to keep your alveoli open, because even if that air comes out, your alveoli would collapse. So this amount of air is necessary to be kept inside the alveoli to keep them open. So that is known as what? Residual volume. And then the final term is expiratory reserve volume. Now, this is the opposite of inspiratory reserve volume. Now, what is expiratory reserve volume? If you ask somebody to blow out with maximum effort, so take air out of their lungs with maximum effort, that air from that, if you subtract the tidal volume, what you get is expiratory reserve volume. So expiratory reserve volume is the amount of air over and above the tidal volume that somebody can expel out of their ears with maximum effort. So four volumes. What? Tidal volume, inspiratory reserve volume, residual volume, and expiratory reserve volume. Now with this we can calculate the capacities. So if I join these two fingers together, what I am joining? I am joining the tidal volume with inspiratory reserve volume. Tidal volume with what? Inspiratory reserve volume. Now let's talk about calculating the capacities from these volumes. I talked about tidal volume, inspiratory reserve volume, residual volume, and expiratory reserve volume. So if you combine the tidal volume with the inspiratory reserve volume, we call it the inspiratory capacity. So the inspiratory capacity is the maximum volume of air that can be inhaled after a normal exhalation. Imagine I suddenly ask you to take a deep breath right now. So that amount of air that you would take inside, that includes your tidal volume, and above and beyond that, the maximum amount that you get inside, that would be the sum of your tidal volume and inspiratory reserve volume, and we call it what? Inspiratory capacity. So these two would equal what? Inspiratory capacity. Now, if I combine the residual volume with expiratory reserve volume, these two fingers, right, that is known as your functional residual capacity. So functional residual capacity is your residual volume combined with what? Expiratory reserve volume, and that is the volume of air left in the lungs at the end of a normal exhalation. So when you normally exhale, you have still got air inside. So that is the equivalent of your residual volume plus the expiratory reserve volume. So that becomes your functional residual capacity. Now, if I combine these three things together, that is the tidal volume, the inspiratory reserve volume, and the expiratory. Since the expiratory on that side, so let's say we switch over these, okay? So that would become your vital capacity. A vital capacity is actually the maximum volume of air that you can exhale after a maximal inspiration. So this is what we ask patients to do in spirometry testing to when we are calculating the FEV1 by FVC ratio. We ask them to take a deep breath in as much as they can inhale it and then breathe out with maximum force. So that is actually we are looking at the vital capacity. And if we combine all these together, that is known as total lung capacity. So total lung capacity is the sum of everything. That is your tidal volume, your inspiratory reserve volume, your residual volume, and your expiratory reservoir volume. The importance of that is that the total lung capacity is usually decreased in restrictive lung disorders and might be normal or increase in obstructive conditions. So when we are doing the spirometry and we are doing all these testings to see what is the inspiratory capacity and what is the sort of vital capacity, we are actually looking at whether this is a restrictive lung disorder, whether this is obstructive lung disorder. But remember in this that the residual volume, the amount that is left inside, you cannot actually measure it by simple spirometry alone. That requires either helium dilution, nitrogen washout method, or body plethysmography. But obviously, we can calculate the tidal volume and we can calculate the inspiratory and the expiratory reserve volumes. So this was a simple lecture on the lung volumes and the lung capacities and how to calculate that with the help of very simple methodology. Hope you have liked this video. Give me a thumbs up if you liked it, and if you haven't subscribed, do subscribe. Thank you. Take care and bye-bye.